Listening to your lecture today about electrical interferences and potentials generated by all kinds of dental materials, what's the practical take home here? I mean, how do you take what you know from a forensic point of view and turn it into clinical applications?
Dr. Steve, when you get the answer to that, you write the book.
Okay, we'll do it together.
From the standpoint, if in fact we are doing the exam,
just closer to your mouth.
If when we are doing the exam we find any evidence of current flow or current...
Hold it up like that.
Does that help? Thank you. I think I could do very well without it altogether. If in fact we find any evidence of tissue irritation or tissue retraction, those are the first signs that we need to look at to determine whether we have already placed something that may not have needed to be there or shouldn't have been there. And certainly when selecting secondary restoratives, that's also when we need to start looking. Infections that do not heal, infections that exacerbate. If in fact we start getting migratory pain in other parts of the body, it used to be in my mouth and then it went to my neck and now I've got this terrible thing in my back. Probably where we need to start cleaning that up is not with a back surgery, but with an oral cavity rework. And so I think the take-home, Steve, is primarily where do I start looking when this patient sits down in my chair and what do I do with what I see?
Okay, I have a question for Dr. Richardson. You talked about the reference exposure levels and how silver and even some gold fillings, like not a silver filling, but actually the silver in a gold filling has some reference exposure level, right? Why? You want to comment on that?
Why did US EPA set a reference exposure level for silver, for instance? Well, they base that reference dose for silver on, what's it called? The effect that silver exposure causes your skin to discolor. Algeria, thank you very much. And they set a level that should be low enough to prevent that effect from occurring. The reason they set one is because silver shows up as a contaminant in Superfund sites and other contaminated sites for which the US EPA is responsible. And they don't bother with things that don't show up. So it's obviously, I didn't go into the details of, where and why, but,
I have a question for Dr. Richardson. And this is a takeoff on a follow-up. A question I had for him at lunchtime today is that I do hair analysis, element analysis on most of my patients, and about a third of them show a complete absence of any lithium at all. And these patients often have a low white blood cell count, and they also tend to be depressed. And by supplementing them with a physiological dose of lithium citrate, their white counts usually rise 1 to 1.5 points, and their mood improves. And his comment earlier was that, I'll let him make his own comment, but that the lithium citrate that I use is the safest form of lithium. But if there was a significant amount of lithium leaching out of composites, wouldn't I see high lithiums in people's hair analysis?
Well, it's potentially leachable out of ceramics, not composites, but it's neither here nor there. The next bit of research that we hope to do, myself, a colleague from the University of Waterloo in Ontario, is to look at the bioavailability of the lithium from ceramic materials. Matter of fact, a number of members of this organization have offered to provide me with samples of the various ceramics they use in their practice so we can use those in those investigations. you know, there are a number of examples where agencies set these reference doses for substances you wouldn't think would be necessary, for copper, for zinc, and other essential nutrients, where we need some, but having too much is a bad thing. I don't know about the essentiality of lithium, but there are a number of substances that are delivered in prescription drugs, you know, that are issued by doctors to patients, et cetera, that, you know, if you get too much of them, isn't necessarily a good thing. So the answer to your question is still yet to be answered, I think.
I had a question concerning the risk assessment of the use of titanium, not only in dental implants, but in hip replacement, knee replacements. Is there a risk assessment with that? And then general to the whole panel, if anybody knows any bad effects from anything like that just from the material alone.
In terms of risk assessments of titanium in, say, hip or joint implants, I'm not familiar with any particular study that's been done on those materials specifically. And whether or not they're an issue in that regard, I don't know. Of course, the trade-off with most risk assessments are there benefits to be gained by the risks to be faced, and increased mobility and less pain may well be a trade-off that a patient is willing to take for some exposure to titanium or other metals. You know, there are those trade-offs to be considered.
I'd like to let you know about the MELISA test that was developed over in Europe. And in my clinical practice, before I was introduced to zirconia implants, I was pre-screening my patients for hypersensitivity reaction to titanium. It's also been written up in Time magazine a number of years ago that titanium is the new mercury. We're coming up with sensitivity reactions of almost 1 in 3 people. So it is definitely a concern. As a dental community, we are aggressively putting in titanium implants. The other thing I'd like to comment is I'm a member of the Tissue Engineering and Regenerative Medicine Association. And when I meet with biotechnologists, they all comment that there are issues with metal. There are issues with titanium implants, not just of the dental variety, but for example, in skull replacements where people have had massive head injuries or they've had brain tumours. They all comment about there's corrosion oxides that are formed, and they know that it's not the answer. So the trend in the orthopedic section is definitely moving into metal-free and ceramic alternatives.
Looking at data from 57,000 patients, it is rarely the titanium that is the initial problem. Seems to be an amazing metal, but they must add something like vanadium or zirconium or niobium or other such things to the alloy. Those are the ones that we seem to see causing issues, and I get the feeling that it initiates the reaction against titanium because titanium was in close proximity. And that's where we would perhaps want to be a little bit cautious. We also notice that when we are working with some of the implants, that titanium by itself, I'm sorry, I lost my train of thought. We'll come back to that.
Yeah. Yes, hi there. It's for the fellow that was speaking on ozone. I'm just wondering what your experiences have been, if any, as far as using ozone around cavitations potentially, or around root canal teeth, and if you feel there's been success in those areas for the use of ozone.
Well, for cavitation, I think it's pretty profound. You can really do a lot of non-invasive work with that outside of surgerizing the area, and you can have some pretty significant success. With root canals, you know, I tell my patients it's a palliative thing. I mean, you can calm something down and you can get an infection under control with ozone. But if there's necrotic tissue, if there's a fracture, if there's some type of functional issue, it's not going away. And you know, where you see some, you know, some help with ozone is when you have a bridge or you have something where the patient's going to lose a significant amount of teeth because something went bad. You could palliatively treat this with ozone, but you're not going to fix anything. You know, the root canal is not working, and you know, you need to get the tooth out. And again, ozone it afterwards, which is a good help. But you know, for cavitations, I find it very profound. But root canals are what they are.
This is for Dr. Richardson. On your studies on the materials, nothing was said about nickel and the high nickel alloys that are used here in China and otherwise. But what have you found on the nickel? And that could be part of a question for Dr. Clifford there.
Well, nickel is nickel chromium alloys and that sort of thing used for bridges and dentures and that sort of thing is on the list of stuff we hope to cover at some point in the not too distant future, but really haven't launched into it at all. From a general risk perspective, if we find nickel compounds in a contaminated site, we're generally concerned, but certain forms of nickel are carcinogenic, et cetera. But to an assessment of the specific forms of nickel and other metals associated with metallic bridges and that sort of thing we have not launched into yet.
Any other questions?
This question is for Dr. Lisa Matista. You have a whole wellness center in Australia. Can you please explain or describe your dental practice and what that looks like for us?
All right, love to. It's been a very ambitious project, and for probably the last 6 to 7 years of my life, I've been traveling around the world looking for cutting-edge technologies that enhance the body's own healing mechanisms. And I've brought all that together. I've certainly looked at other professions as well. For example, when I learnt about, when I did my acupuncture course, it was under medical acupuncture because nothing like that was being offered in Australia for dentists. I look at what's happening in the cosmetic industry as well. So within my practice, I'm getting into regenerative dentistry. I'm using autologous stem cells from the blood, and it's a European company called Silfredent. Here in the USA, PRP, plasma-enriched proteins, has been introduced. This European version provides a better systemic response of enhancing the immune system and a greater yield of stem cells and growth factors than the current PRP system. So that's one thing. I've also done ozone training in New Jersey with Bob Harris and Phil Mollica. I use a lot of light therapy, so I've put together my own health philosophy of three very simple things. The first being eliminate your toxic exposure personally and environmentally, hence my advocacy for mercury-free dentistry. The other is to have optimal cellular nutrition and oxygenation, use of ozone and oxygen therapies. And the third is sound restorative sleep. Dental sleep medicine is something that makes a profound impact on your patients. So the two areas that I get greatest reward in my dental patients is dealing with the neurotoxicity with mercury. But probably the most dramatic response is when you give somebody a good night's sleep. When you restore their oxygen levels to normal levels by specially designed sleep appliances, that corrects your bruxism. Sleep bruxism is driven by an oxygen drop of 3 to 4% in your blood, which is triggered from sleep apnea events. So in my centre, I have a dental component. I'm working with a naturopath. I've got a detox spa. And it's all very much in its infancy. It's all very challenging, but and I'm also put an environmental focus on it too. So the products that I bring into the clinic, I like to make sure that they are of a sustainably produced nature. You've got to think about whether it's good for you, if it's good for others, and if it's good for the planet. And it's having those 3 levels of consciousness. So that's where I've grouped it all together in what I call the Holistic Wellness and Vitality Centre.
Yeah, I was just wondering, I mean, you guys are all obviously extremely bright and have thought about your own areas a terrific amount. I was wondering if I could ask whoever would like to comment on what kind of they think is the #1 best kind of pearl that you could throw at us that you think we should keep in mind from your vast experience that you think we maybe missed or don't have on a daily basis on our minds. And yeah, just leave it up to you to let us know what you think is significant.
Eat lots of roughage. Well, from a risk assessment perspective, I've been asked, about, should people use dental amalgam and this sort of thing. If I had a choice between having no dental care and having to use dental amalgam, and I must say, I don't know the whole picture on the health consequences of having very poor oral hygiene and all of that sort of stuff, but it's very significant. And if I had a choice between no care and only amalgam, I have to be honest, I'd probably opt for amalgam. But we're very fortunate to have, despite what Health Canada might say, we have a number of suitable alternatives now where we don't have to use a mercury-based material. And I think I tell people not to rush out and have all their amalgams removed or anything, but when they need to get replaced, think about using an alternate material. And that, I think, is, for me, a take-home message. Don't rush out and have 15 taken out or anything like that, but when they need to get replaced, find something that's more biocompatible, less reactive, doesn't contain mercury, etc. For me, composite resins, I think, is kind of, from a risk perspective only, seems to be maybe the best case. Ceramics are very close. The question about lithium still has to be totally answered, but one of those two are probably the least reactive. Gold has its problems, and obviously amalgam does.
Well, in keeping with the theme of what we talked about, I think that taking at least as much iodine every day as Japanese women take on average is a reasonable idea. 12.5 milligrams a day, combination of iodine and iodide. It's available in a form of tablet called iodoral, and perhaps other forms too.
Yeah, from my perspective, we've been giving iodine and we've seen a dramatic decrease in the number of breast cancers in my clinic. We used to diagnose breast cancer maybe once a month, and it's been now about 3 or 4 years since we diagnosed a breast cancer. So by being aggressive at treating with iodine, we've seen that go down. Probably the most interesting is the fact that you got a woman taking iodine and all of a sudden she gets pregnant. It turns out that iodine deficiency is the #1 reason for infertility worldwide. Iodine insufficiency is the #1 source of mental retardation in the world. And it turns out that iodine, when you give iodine to a pregnant woman, that iodine will give you babies that have an IQ that's about 20 to 30 points higher than the mother. So basically we've got about 20 babies in my medical practice where the mothers took iodine throughout the whole pregnancy, and these kids are now turning into, the oldest one is 11 years old now, but this particular child does her 6th grade schoolwork, but because she's such a genius, all afternoon is spent taking college courses. And so we've when she was bored in school, and so she, the teacher said, "What would you like to take to try to help you out?" And she said, "Oh, I'd be interested in taking a college course in English. I just love words." And this kid took a college course in English and made straight A's. The next year, because of her, we had 5 kids that showed up at that same school, all geniuses, and the principal noticed all of a sudden that these kids all had the same doctor. And so they came to me and said, "What are you doing with these kids?" And I said, "It's not what I'm doing now, it's what we did years ago." And all these children wanted to take courses like PowerPoint presentation. The last course they took was on Excel spreadsheet and how to manipulate this spreadsheet and so on. And I don't know what class they've chosen for this year, but the thing is that the college teachers that are coming in to teach these little 6th graders are, they're sitting there saying, "These kids are smarter than the batch I got right now at the college," But they're all, we've got 20 of these children in the practice, and they're all literally geniuses. You can't teach them fast enough. And so we end up having to make sure that they get a rounded education, that they take music classes, they take art classes, that they take, otherwise they turn into bookworms, and all they want to do is keep their nose in a book the whole time, just soaking in the knowledge. And so, but if you give them the amount of iodine as if they were a Japanese mother, Japanese eat on average about 13.8 milligrams a day. We figure that, and that's millions of women in Japan, millions of women all over Korea taking iodine, and their kids are just coming out phenomenal. Now, if you think about it, in Japan, we have 26 letters in our vocabulary, and so on. In Japan, it's 5,000 characters. And the kids spend a good amount of their time learning how to do their characters and so on and so on. But, I can see why, because, and among the peoples of the earth, in fact, here in the United States, when they do IQ testing, what they find is that the children with the highest IQs in America are the children on the West Coast, who are the children of first-generation Japanese that have migrated here to America. As they live here, within 2 or 3 years, 2 or 3 generations, their IQs are just like the rest of us. But the more iodine they eat in their dietary, we're talking seaweed at least 2 or 3 times a day, etc., we're talking about children who have some of the highest IQs in North America as it is. Just iodine during pregnancy, and you'll just do a Google search on the topic of iodine and IQ of children, and you'll see the articles that have now been published showing that there is a bump in the increase in the IQ of these kids. So that this is not George Fletcher's talking, this is what's going on out there in the real world. So it's definitely, and I think this society here, this academy can influence the next generation of children that are coming out, because every one of you takes care of pregnant ladies. And we can influence the next generation by generating a group of children who are very high IQ. It's the absence of iodine that is, that has now been documented to be felt to be due to the problem of attention deficit disorder. And from the year 2000 through 2010, ADD in the United States went up 500%. We can influence the next generation, and we can do that by simply giving these mothers iodine throughout that pregnancy, and it would be the same amount of iodine as the Japanese are eating on a daily basis. we make sure that we supplement their the iodine up until about age 2, because the human IQ is set in concrete by age 2. So beyond that, it doesn't make that much more difference. But as we get older, iodine, the ovaries use iodine extensively for making their steroids. And so we've now discovered that iodine also stops PMS very dramatically. So, and that's because it helps the ovaries to produce their steroids a lot more effectively. So once a girl gets to become goes into, prepubescence and so on, we can do that. Here's another one. If you've got a girl who is 5'10", 5'11", and you want to stop her from growing, what do you give her? You give her estrogen, because estrogen decreases, it closes off the end plates of the bone and keeps the bone from growing anymore. So you can stop a woman from growing anymore if you give her some estrogen. What happens if you give a woman something that inhibits her ability to make estrogen? What would you do to her height? And so we've now got the answer. We had a girl that wanted to be a volleyball player. She was 4'9", wanted to become a volleyball player, but she was 12, and the parents asked me, is there a way that we can stop her from making estrogen to help her to grow taller? Well, we gave this girl iodine because iodine inhibits the ability of the body to make estrogen. Out of 16 steps at the DNA level, 14 can be inhibited by iodine. Well, this girl, 3 years later, she did not start having her periods till she was 16 and a half years old, and today she's 5'11" tall, which says that we can manipulate the genetics of what type of humans we want to in the future with the use of iodine. It's just a reverse of what we've done by giving estrogen to stop a girl from growing. We can now give iodine to help them to grow taller if that's what they want to become. Today, this girl is being chased after by 15 different colleges that all want her to be playing on their volleyball teams. Yes, because estrogen is what stops us from growing. And so, so if you give iodine, you inhibit estrogen, and therefore the skeleton continues to grow. In fact, very interesting, at the University of Cincinnati, they had a male who was estrogen receptor negative. He had no estrogen receptors in his body, and so his skeleton continues to grow 2 to 3 inches a year. He is currently 9'11" tall, and they can't figure out a way to stop him from growing because he has no estrogen receptors. Well, you would have to deplete him of iodine to keep him from making any estrogen, because if you deplete him of iodine, then he can't make he continues to make estrogen, but there's no receptor there to recognize the presence of the estrogen. Yeah. But that's basically what's going on. Oh, by the way, the reason he said that move to England, the British took iodine out of their diet. The average American right now is eating 150 micrograms of iodine per day. In Britain, they thought they were getting too much iodine, and for the last 3 or 4 years, they've been eating salt that contains no iodine. They took their fish, they thought they were getting enough iodine through the fish and chips that they eat. It turns out that Britain today is among the top 10 nations in the world with the least amount of iodine. So guess what's happening in Britain? A tremendous surge in ADD in children and a tremendous surge in cretinism, which means that we're producing a bunch of British that are mentally retarded. Yes.
Lisa, before I ask my question, Lisa, did you have something you wanted to throw out as a pearl?
My pearl was very simple and not a scientific one. And this is it. Treat your patients as you would like to be treated. So before you do any procedure, before you put any product, would you want that to be used on you? So that's just a simple approach there. And it's not original either.
I had a question for Mark Richardson and Jess Clifford. But before I ask it, I wanted to thank all of you for the presentations you gave today and a great day. So thank you all for that. Mark, you had mentioned on ceramics with lithium, if they're under 0.5%, there should be pretty much okay. And I don't know, and this is what I want to ask you and Jess together, I don't know if there are different kinds of lithium compounds. I'm familiar with the lithium disilicate. I don't know, Jess, you would probably know more about the elution rate of that, how it might be absorbed into the body, but could either of you comment on lithium in restorative materials and what risk they may pose?
Well, certainly there are different forms of lithium. There's going to be a number of different compounds depending on the source, depending on its purpose, whether it's delivered as a therapeutic agent, part of a prescription, or whether it's leaching from dental materials. So certainly there's going to be different forms. They are absorbed at different rates, and depending on their form, they will interact with the body differently. Whether or not the lithium content of ceramics is truly an issue, we speculate on, based on all of our calculations and the research we've done, it appears to be the only issue that might relate to ceramics, and there's still some research to be done to define that, sort of final bit of the picture. But certainly the different forms of lithium will influence how much is absorbed, whether or not they'll interact with the body and that sort of thing.
Rich, with the lithium, we rarely see a sensitivity to it. We do see some materials that hold up marvelously well that are made from it until you get zirconium in the mix. And we have been watching very quietly. When you get a zirconium implant that is not reossifying well, where we've got some failure in the growth, we often note that there is a crown that was placed on it of dilithium silicate or some such. I cannot say that that's causative. It may be coincidental, but it is an area that's emerging and would certainly be worth watching. I can tell you there is no perfect restorative, and although I hear manufacturers making wild claims, seldom can we see them borne out.
A few years ago, the NIH did some studies on lithium, and what they found is that when you take lithium, it inhibits the development of dementia as we get older. The recommendation was to take lithium on a daily basis, and we're talking close to 200 milligrams a day to inhibit the development of dementia. So go to the Google and look it up, but I think you're going to find that the amount of lithium leaching out of these ceramics is minimal compared to what NIH is recommending to inhibit dementia as you and I are getting older. So if you're having discussions about, are we getting too much lithium out of these ceramics, you're nowhere even close to what the NIH is recommending for inhibition of the ability of the brain to develop dementia.
Question to Lillian, who some of you may know, some of you may not know. Lillian has done tremendous amounts of work in her home country of the Philippines, and I had the pleasure of working with her in the INC work, and I was just going to ask if you could outline some of the greatest challenges that your environmental minister is going through as you go through the phase-out process of the use of amalgam.
The process in Philippines, like working with the government?
What I was just saying is, what are all the considerations, as in, what are the leftover mercury? What are you doing with that? How do you handle the old mercury, the old triturators?
It's very challenging in Philippines because we don't have the waste management protocols yet with government. Yes, closer. Okay. Sorry. Very challenging in Philippines because we don't have the waste management yet, and there's no storage facility for the mercury-free mercury waste. So, like right now, the Philippines is working with the Department of Health and Environment, and Department of Environment and Natural Resources is working on the facilities design, but it's a big challenge. We don't know where to put it. The government doesn't know where to put it, so we have this temporary storage in every facility. So there's no policy in the government yet, so the mercury waste goes down to the drain. And we're measuring tremendous amount of mercury emissions in the air and the wastewater. I have to be honest with you, I just have my own way of doing the separators. I don't have the actual machine that you have, but I have my own design by my engineer who helped me with the waste management for the mercury waste. I've been going around schools, in the dental schools, and we're checking for the waste themselves, and we were able to collect tremendous amounts of mercury vapor emission from the waste themselves. The students are carrying the waste in their packets, their dental packets, when they go in the clinic and they go out of the clinic. So we are able to measure about 39,000 nanograms per cubic meter in the small waste can that they carry around, and it's all over the place. So right now we're working with the government, and we have this strategic planning program for the phase down of mercury and mercury containing products and devices in healthcare facilities in 2016. And hopefully our government will really push for the phase out. Actually, I'm working with health Consumers for Dental Choice, World Alliance for Mercury-Free Dentistry. Charlie Brown is an attorney. He helps me with the policy making to help us phase out the mercury in the government. So right now we're in the process of approaching the curriculum of the dental colleges also to help us phase out the mercury in the dental schools, because the schools, the students, and the professors are really exposed to the mercury vapors, and it's a shame if they don't take it out from the curriculum. Thank you.
Thank you to our speakers. We have the welcome reception just next door. That'll conclude our speakers forum for today. Thank you, everyone. Goodbye.
Yep,